to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskfield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
I'm so excited because today Dr. Benjamin Miller is joining us, and he's a longtime friend and colleague and an incredibly impressive leader in the space of mental health throughout the country. He is adjunct faculty at the Stanford School of Medicine, as well as the current chair of the advisory board of an incredibly amazing organization, Inseparable, along with a lot of other things. But we got to get talking about what we need to talk about today. So, Ben, thanks for being here.
Heidi, it's a pleasure. It's good to be with you.
I'm so excited to get to have this conversation with you in particular, because I feel like I can ask questions and say things that you will appreciate where I'm coming from in a different way. So you're like at a lot of different tables when it comes to youth mental health specifically, which is what we care about. What are the most common themes that groups and advocates are wanting to address when it comes to system reform? Like, there are common themes. What are they?
Yeah, well, when you talk to families, I mean, the most common issue that they raise is that I just couldn't get my kid into care. Mm-hmm. And so in the policy world, we typically describe this as access, but most people just say, I want help or I needed help. And so I think that's the number one thing I hear on a regular basis. I mean, not being able to access care for your loved ones, especially when you're in a time of crisis, it's just a problem that's taken way too long to solve. I mean, I've been doing this stuff for over 20 years now, and I swear every year it's the perennial issue. It's the one that everybody wants to say, we got to increase access, we got to do it. And the families are the ones that are most desperate. So I think that's probably number one.
Yeah.
I mean, hands down, number one. Number two are issues around integration and fragmentation, which again are buzzwords that we typically use. But families and youth specifically will describe how frustrating it is to get into a system that they don't know what the rules are.
Yeah.
I think of it like Heidi, like a lottery. You can play the cards, you can do the thing, put your money down, whatever, and you don't know what you're going to get. That's kind of what the mental health system is like, because it's so fragmented and inconsistent. So that's the second thing I hear a lot of is like, how do we make it where it's a lot easier for me to navigate and navigate where I can be assured that what I get on the back end is something that benefits me and is of quality. The third, which I'm hearing more and more now from our kids, you and I would probably describe it as like issues of equity. But it's really about like, stop pretending that one size fits all.
Right.
I mean, how many years have we talked about like, well, you can't treat kids like little adults. You have to be totally different. You're thinking, well, for our youth, they're very much saying like that system that you guys built, that legacy that you're holding on to is yours. That doesn't work for me.
Like not even close. Like not even close.
Not even close. And so how do we redesign that so that it's about me? And I think of that in terms of like equity, like really leaning into different strategies for different populations. But that's the third thing I hear a lot of is like, make it mine. It's right now, it's yours. It ain't mine.
Right. And even like the way we approach conversations with youth, right? Is like, are you serious with these questions that you're asking me? Like, you are the ones responsible for helping my mental health? Dear Lord.
Yeah. Or how many acronyms can I put into a paragraph and, pretend that you're supposed to know it because I'm so, enlightened in the policy world. Yeah. We got to even be careful with our language, because when you talk past someone who ideally you're trying to get give you the solutions.
I know. And as a parent, like I get that. As a chief complaint filed with the chief complaint officer in my household, like, can you figure out a different way to relate to me, please, like a human? So there's that. I feel like when you're talking about the navigation piece, I always get this visual of the Candyland game board for those of us in our generation. I mean, I think some kids still play Candyland, but it's like, it totally depends on the roll of the dice, whether you're landing in sort of lollipop field or molasses swamp. Like it's completely arbitrary and there's nothing to ensure that in the end, I'm in Candyland, right?
Yeah. Or you think you're about to win and you get that card that takes you back to the beginning.
Sends you back. Yes. Yeah. Oh, so frustrating. Yes, this is what I think of. Okay, so we're talking first about families and advocates. The next thing, obviously, is you're also plugged into what different states are doing and where they're spending their time and their energy and probably even most importantly, their resources. So how would you sort of summarize when it comes to the youth space, what states are doing and where they're focused right now, besides making sure their kids are actually enrolled on Medicaid?
Right. I mean, come on. Besides that. Yeah. So I'll get into the specifics of states in just a second, like what maybe named some names. But I think in general, we're seeing a lot of this movement towards what I'm very happy to see of bringing care to where people are. And so for our kids, we know that most of them spend their waking hours in school settings. And so to be able to see legislation that's passed, that's bringing more resources or providers into schools is excellent. It's an excellent thing. Really thinking about how we can reinforce this place that's supposed to be safe and educational, that also, might also benefit your mental health. I mean, these are things that I'm really seeing states lean into in pretty significant ways. We're also seeing that we've got these fancy phones that we use. We've got this technology that supposedly is supposed to be this wonderful gift from the heavens. But I think you also have seen states really lean into that just a bit, whether it's telehealth, which is not a new concept. We just like to pretend it is, but leveraging technology to create new and creative pathways for youth to be able to get resources, be connected to others. I mean, it feels like we're on the cusp of something interesting there without necessarily pandering to all the startups and all these apps that nobody uses. Right. There is something in the technology space that I think states have really tinkered around with to try and increase our ability to better connect to that next generation.
When you were talking first about the school component, I just have to say, one of the things that keeps coming up for me, and not just because of the conundrum presented by FERPA and HIPAA, but it is like...
Acronym police.
Right. Like privacy laws that don't allow you to exchange important and health-related information between mental health providers and schools to like co-support in a team-based way youth, right? Like that is annoying. Like in an effort to protect our privacy, we've created a very annoying obstacle at supporting our kids' mental health. But the other thing that comes up for me that I'm just sort of curious what you think, I have a hard time getting past in school settings where there's no school-based health center and you're trying to deliver mental health care. There still feels like this disjointed structure that allows for the effective delivery of clinically based care in a school-based setting if you don't have a school-based health center. So that could be made up nonsense, but I'm just sort of curious your reaction to that.
Well, yeah, I think you're spot on. And for the sake of argument here, let me give you three things that I think really should be focused on when we talk about mental health in schools, where clinical delivery is one of them. So I'll give you another two. Okay. Because you're right. Often it's hard for schools to have the resources, the infrastructure, the capacity, even the space, let alone access to providers that can work in a school setting if they don't have some type of school-based health center. So that's one, and I do think it's important to pay attention to, but it's not all we can do. There's other things. I mean, the second is I actually feel like we have an opportunity within schools to do a better job equipping our students, the youth, with skills to know how to help each other and help themselves. Right. I mean, if you want to empower the next generation, the most important thing you could do is give them the tools. And I realize in this day and age, there have been politics that have been wrapped around this, unfortunately, that have held hostage, for lack of a better word, this mental health training in our schools. But really, truly, our kids, when you talk to them and you say, well, what is it you feel like you need? They say, I want to know how to help somebody else. And
Yeah.
they're not equipped to do that in schools. So that's the second thing. I really think we have to focus in on training and education and give them a little bit more of those resources to know how to respond to each other, because they're the first line of defense with one another.
Yeah.
The third is around just education in general. And I think about, I mean, I have a junior in high school right now, and I think about her. I have another child who's in fifth grade. She's important too, but I'm thinking about my junior for just a second, just in case they ever listen to this. I don't want them to think I forgot about the other.
Right.
And I watch some of what they are taught, and I kind of see how the school has an opportunity to focus in on things that they simply don't, because they either don't have the wherewithal, they don't know what to say. But my daughter's taught all kinds of things that I feel like are fine, but don't necessarily aren't going to contribute to her overall mental health and well-being. This could. Simply adding in another class or a lecture or some component that educates these kids. We do this. We know there's a research base behind this in terms of social emotional development, but it's been again, hijacked and not necessarily put into the schools the way that I think could most help our kids.
Well, Sunday on a different episode, because I hope you'll come back, we can talk about the need to reform sex ed if you want to start talking about controversial subjects as a way to prevent deep fakes.
Yeah.
I mean,
yeah.
We can't regulate it out of AI. So we'll come back and we'll talk about sex ed and respecting ourselves as a way to respect others. Okay, I digress. When you are talking about the work that states are doing to improve the delivery in schools, both in sort of direct clinical care delivery, but other sort of training and resource supports for teachers and administrators, coaches, what's making the biggest difference? Or what are you looking at and going, whoa, that is something we really need to think about replicating across the board?
Well, I think we can thank the current administration for all that they have done to infuse copious amounts of resources into our schools for mental health. I mean, not a lot of people pay attention to this, but if you look deeply within the Bipartisan Safer Communities Act, there is a substantial amount of money for kids and mental health.
Yes.
And so I think the number one biggest thing that's making a difference right now is access to resources that many of these schools have never been able to touch before. Yeah. Now, ironically, many of these schools still haven't touched those dollars because they don't have the infrastructure to get to them. But that's, again, maybe another episode. But I think number one is the availability of capital that can be just immediately infused into the schools. The second is a recognition. And this is almost like an awareness piece that I've seen where our teachers and our students, they're demanding for more in the mental health space.
Yes.
And that demand, I don't know if you and I have seen something like this within our lifetimes, because it's not just about awareness, not just it's important. It's hey, listen, I need more.
Yeah. What are you going to do about it?
Yeah. To have the kids show up at the school board meetings. I mean, that's powerful. I think that stuff makes a difference. It's not just another program. It's not just another box you check. It's really about watching these kids mobilize and then show up at the right places to say, you know what, pay attention to me and my mental health.
Yeah. Well, and I think you and I both agree, when kids get to speak for themselves and when the adults in their world are responsive to those needs, and we're not asking them to find their way through the already existing morass, we're on a much better track.
Well said. Couldn't agree more.
So I'm going to pivot a little bit, and I want to talk now about the lawsuit here in Colorado, because that's our main theme. And because of your familiarity with all things here, talk about, from your perspective, as we're beginning to launch this very significant effort to ensure that the state is in compliance now with this very big settlement agreement, what are the strengths that we do have? Because we're not starting from nowhere. And also, what do you feel is urgent, that we just have to get to now?
Well, Colorado as a state, I think one of the unique attributes it's always had that I found to be compelling is that there has not been a dominant payer. It's always been a very collaborative multi-payer state. And I realize that we're talking about Medicaid just for a second, but having other payers that are in the state that can pay attention to what's happening within the state matters greatly, especially when you do managed care. And so I feel like that is a huge asset, that you can leverage a lot of these payers, especially considering the number that we have, to really maybe lean into something that's a bit bigger. The second thing, which I think is unique about Colorado, is that as long as I've lived in Colorado, which I don't live there anymore, full transparency, but I lived there for 15 years, it has always been a state that I felt like was willing to try things before
Yes.
everybody knew what was going to happen.
Yes.
Now, and there's good and bad examples of this. And so maybe I won't name some of them because you and I will laugh and spend the rest of our time talking about the good and bad examples. But I think that Colorado has been unafraid of risk. And that has transcended whichever governor's in office. It's like, let's pursue things that might be a little bit out there, but could potentially have a huge benefit for our community. So I think that's the second thing, is that there's a lot of leadership in place that is willing to go after this stuff in a pretty significant way. The third thing about Colorado, which I love, is that already at a baseline, when I first moved to Colorado, this is a long time ago, people always said, Coloradans are so healthy, they're outside all the time, they're enjoying that sun. And there's some truth to that. But because it's so, for lack of a better term, in the water, there is this notion that we must be the healthiest state. We must do things to improve the health. And that culture, I think, goes into things like discussions on policy. Or what does it mean when our state is held accountable for its transgressions? I mean, like, these things really do begin to rise up, and you start to see them when you're in that community. So I think those are kind of three things that for me just stand out as like why Colorado is unique and why it is kind of a big deal that other states are going to have to pay attention to how this goes for Colorado.
Yes. Yes. And then when you're looking at like the obvious or maybe not so obvious gap areas that, as we're thinking about phasing and staging, because we can't flip the switch on everything all at once.
Of course.
From your perspective, knowing what you're seeing across and through, like what has to happen now?
Yeah, there's two things I think really that you're at the most risk of getting wrong if you're not careful.
Yes.
One is authentically engaging community and then not listening to what they say.
Right.
As you and I've talked about, one of the unique aspects of this particular opportunity in Colorado is the stakeholder engagement. And spending a good amount of time listening to communities, those with living experience that are on the front lines, that know how tough it is, that have seen the denials, have seen the fragmentation. By not listening to them, that just opens up a whole nother can of worms that I think could be problematic for the state. So the first thing is that if you don't listen, you're probably not going to create the solution that's going to have the most impact. The second thing is a lack of public accountability that oftentimes comes through not having transparency.
Right.
And so you're going to have a little bit of time to allow for folks to weigh in, to have their voices heard. Then the state's going to have to get its act together and implement whatever the plan ultimately is. The public is going to need to be made aware of how's it going. You said you're going to do these three things. I heard you say them to me. How do I know you're doing them? And that's where, Heidi, that to me is like, that's the exciting part and also the terrifying part of a lot of transformation work in mental health, is that typically it's a black hole. We don't know what we're going to get when we put something into the system. We have relatively we're opaque at best, but there's not clear line of sight and oftentimes line of responsibility. And so increasing that culture of shared accountability is something that the state is going to have to really lean into and embrace it. I worry that if we don't kind of knock those two things out of the park, the best intentions will just not be good enough.
Well, I appreciate you talking about those two things. I want to talk about them a little bit more. Yeah. So I just came back from one of the state's stakeholder sessions. What I really appreciate about their current approach is that they are showing up in person throughout the state, and they are working to engage people by providing them with an initial plan to react to. So they are doing the roadshow. They are talking to people. They do have a very good plan for how they're going to, over the next couple, and maybe very good is a little much, but I think they're doing a good job. And I think they're being thoughtful. And I do think that the department wants to get this right. So having said all of those things, the thing that I also noticed is in the work to get this right and make a difference, it is still very much a state-driven model. They're looking at how other state Medicaid agencies, for example, are doing X, Y, and Z. And the challenge that comes up for me in all of this is that's not major reform. Like major reform is not how do we better wire things together and ensure sort of better efficiencies in a pretty crappy grid.
Mm-hmm.
Like, I'm curious what you think of that, because I think that's a very different conversation, like in how a state would evaluate itself. I think other states would look at the process Colorado is running right now and go, whoa, they're doing a really good job. But if you look from like the average person, it is like, well, how does this help ensure that I'm driving my own care in a way that works and I'm not going to get all kerfuffled up again? And that the workforce is going to be there and I'm going to be able to afford the things and like that.
This is a very common issue that I think I've seen almost everywhere, which is that in the face of an opportunity like a major reform, we default into the same structures that we've always had and we just tinker with them.
Right.
And so I think that to your point, there's no way to bring about transformative change unless you think through a new structure. To get a little bit nerdy here for a second,
Yes,
when you think about design and you think about how systems work, one thing that's very clear that we understand is that when you have certain structures in place that have been invested in over time, and you've had leaders that have claimed their legacy as that particular structure, it's really hard to change them because in essence, what you're saying is that was good, but it wasn't good enough. And that works against people's own egos and self-interest, which is so hard to solve that problem. So I give this example, this metaphor. I think you and I have talked about this before too, but like I love urban design. I love urban planning.
Yes.
And so I love to walk around neighborhoods and cities and see where they put sidewalks. And a common theme that you'll see is that there are often sidewalks where no one's walking. And if you look at where they're actually walking, it could be a different line in the grass. It could be like a dirt path that you see that emerges next to the sidewalk. People choose to walk on different paths than the ones that we've created. And I can't think of a better metaphor for why we should pay more attention to where people are walking and create the structures around that versus force them to use the structures that we have or walk on the sidewalks that they don't want to walk on. So that's a bit convoluted, but I think you get my point. You have to think differently here. You have to reimagine, well, what are the structures? And I'll give one final example, and then I'll be quiet on this because I get so fired up over this topic.
No, I love it.
But if you think about how you finance things or how you pay for things, typically the funds go through certain pathways to get to the end user, the provider.
Right.
Why not rethink that? Why not just entirely rethink how you pay for care and what you pay for and who you pay for and where you pay for it? When you go through those exercises, you never really come out with the frameworks or the structures that we already have, because usually you're creating something that makes more sense to the communities, which is not what our current systems currently do.
Yes, and more of that. And what I would just say when I listen to you, especially when I think about the analogy of the sidewalks and the financing components, we are in a time and an era and an age where the digital tools that we have available to us allow us to do exactly what we're saying is required here. I had a shocking revelation shared with me the other day. I feel fairly certain this is relevant to this conversation. And that is Starbucks is now one of the largest bank-like entities in the country because of its app. The way that you can interact with your dollars on its app actually makes it one of the largest financing institutions, which makes me think, my God, with one little thing, like an app and how we purchase very expensive, ridiculous coffee, they're beginning a very different way to think about financial management and banking. And that's not hard to do. And so if we can do that with how we buy coffee, why can't we do that with the way that we pay for our mental health care?
Let me taste that one because I love that. I love that example. So most successful companies have reinvented themselves over and over and over again.
Right.
Think about Google. Google started as a search engine.
Right.
Think about Amazon. Amazon has started by selling books.
Right.
All these companies have constantly gone through an iteration of refining itself. You would be hard pressed to find one good example of where we've done that in the mental health system. You just don't see it. And so you don't reinvent yourself. You put a new cover on it or a new name on it, but it's the same thing underneath. It's the same structures. It's like in payment reform. If you just, this is way policy wonky, but if you look at some of the ACOs, accountable care organizations that we saw out there, most of them are still fee for service.
Yeah.
And so it's like putting this amazing, shiny Corvette chassis over a rusted out engine. It just didn't make any sense.
Yeah. Well, and following that thread a little bit, again, keeping to the Colorado context, we have regional accountable entities, the RAEs, right? Handling care coordination and ensuring that certain services are available to members. And now we have the Behavioral Health Administration, which is creating BASOs. So these behavioral health I don't even know what it stands for, but it's like the equivalent of the RAE for kids who aren't on Medicaid and, right? And then we have the child welfare system, and we have the Department of Education, and we have the system supporting youth corrections. It just feels like, in an attempt to create a working system of mental health, we're adding unnecessary, terrible layers. Like, what's it going to take for leaders to really think about simplification in a way that could happen from your perspective?
Yeah, it's funny listening to you say that, and even being so familiar with those systems and structures. All I hear is like silo, barrier, silo, barrier, silo, barrier. And I think you're right. The intent behind, at least originally, thinking through why create a behavioral health administration was to simplify. I remember one of the examples that was given is the multiple where the dollars come out of the state and where they go in. And it was like 54 different funding arms or something like that.
Yes.
Yeah. And so like the goal was like, okay, well, let's simplify that. This is too complex, but yet to your point, we necessarily haven't achieved that vision quite yet. I think this is where we have to kind of go back to the drawing board just a bit.
Yeah.
And we have to ask ourselves really and truly, number one, who should be responsible for health? And in a state context, when you are literally the boundary by which people live,
yes,
you set the laws, the rules, and regulations. It is your responsibility to at least pay attention to the health and well-being of your people. And so that means that just because Medicaid does this or Department of Ed does that or public health does this, it doesn't mean that you have to necessarily relegate health to just those people that use it in their name.
Right.
Why don't we think about broadening this and making it more simple, such as like we talked about earlier with schools? I'm going to get just on fire here, and I'm going to start ranting and raving. But I just, to me, if I gave my kids the state budget of Colorado, and I said, okay, what should you prioritize more than anything else? What do you think they're going to say? What would they say is most important for a state to prioritize?
Health and education.
Yes, which are number one and number two of every state budget. Okay, so we got the money.
Right.
So then you say, okay, well, where would you put those funds? What would you do with them? How would you create those systems? What would they look like? I guarantee you the answers that they give us are more creative and probably more spot on accurate, from a 10-year-old to 16-year-old than anything that we would hear coming out of a meeting that you've probably sat in today. And that's because we continue to invite people to the table who are not necessarily paying attention to the need to radically rethink how and who is responsible for health.
Yeah.
I go back into like our faith communities as one example.
Yes.
Faith communities are a critical touch point for so many lives across the entire country.
Yes.
Okay. And so why are faith communities not empowered or given the skills or tools or resources to do more for health? Barbershops or hair salons or nail salons. These people we have relationships with and we go in to see them all the time. They know your name. They know more about you and your family probably than your healthcare provider does. Why are they not given the opportunity to address issues of health and well-being? The state will never factor that into its equation, which is why I think it's fundamentally set up to be constantly this complex machine that's using the same widgets, the same structures, the same people over and over and over again.
Yeah. Well, when you say that too, the other thing that it reminds me of is a recent conversation I had with my kid's dentist. I have this lovely dentist who always asks me how I'm doing, which is really nice. And when I'm sharing about the work, what he said to me was, what's really interesting is we leave dentists out of the conversation all too often. And we actually see kids more than their pediatricians because lots of families make sure that their kids go to the dentist twice a year. And then if they have anything wrong, it's more than that. And then if you have orthodontics in the equation, like I do, super fun, they're a lot. And we don't have any system that supports other medical providers like dentists to engage effectively in supporting the equation for mental health.
Yeah,
it seems like an untapped resource in a time where we have no workforce.
Exactly. Or we have workforce that's in the wrong places or is so hyper specialized they can't be relevant for your problem. Yeah. My orthodontist story really quickly, my daughter was getting her retainer addressed and actually, no, it was her braces. It was when she still had braces about a year ago. And she was in the general dentistry, which is literally across the hall in the same building as the orthodontist.
Yes.
And so the general dentist did something and realized that he made a mistake and said, oh, we need to get this fixed, but I can't fix it. You have to go to the orthodontist. When can the orthodontist get you in? Oh, it'll be next week. And I was like, this is such a classic example of what people deal with all the time in mental health.
Yeah.
And so it's reinforcing this point that you made about we've created an overly complex and cumbersome system. Nothing about it is really focused on the person and their experience and what they want. It's really just about kind of those chains of command and the structures and the hierarchy and who's got the power.
Well, I'm really excited to keep a conversation going with you that allows us to radically rethink this process. So, Dr. Benjamin Miller, thank you for being here with us talking about this. I have loved every moment of this. So will you come back and will you talk to me more?
Absolutely, Heidi. Thank you so much for all the work that your organization is doing. Thank you for hosting this podcast and getting good words out there like the ones we've had today. I appreciate it.
Well, thanks for helping us get it right here in Colorado. All right. Talk to you soon.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.